Yes, hi. Good evening, everyone. This is Dr. Shaher Khan. Thank you very much for joining me. I have a very interesting guest and one of my former patients, Allysia. She will basically help us understand her experience, her journey, her uh, uh, transition from basically a nice, youthful, young, happy life to getting the implants, and then her experiences to getting the implants, what happened when and next, and how she ended up finding me, and what her post operative course was. And so that we can learn from her experience, I will say Allysia is also one of those patients who came to me very well networked, researched. She had done her homework. I could connect with her on the same frequency like I could with another plastic surgeon, believe it or not, if not better, because she knew and understood breast implant illness vividly. And she could talk about it and give a lecture. And she knew before I would talk next what I was going to say and how I was going to say it. This is how well she understood the breast implant illness, how I understand it. And again, the main motive and goal here is for us, be it the patients, be it the prospective significant other patients, be it the other physicians, doctors, and I certainly do not limit myself to patients with BII, but anyone who is interested in thinking about putting in implants, significant others who are interested in having their significant others put in implants or take them out, and then they can potentially understand what this phenomenon, lack of a better word, this lack of another better word, creepy illness is, and how it defies to be captured, how it fools the many and thousands of physicians, where there are no lab tests, no imaging studies, and where it basically continues to hide, and even in 2019 and as we move forward to 2020, how it continues to elude us. Having said that, I'm going to go ahead and bring Allysia on if you're not already on. And if you could just please tell us about yourself in a sense that as to when you got augmented and what your initial experience was, how you made the decision that the implants were right for you.
Hi, everybody. My name's Allysia Dorman, and I live in Arizona. Can you guys maybe comment if you can see and hear us, just to make sure? So I grew up in Yuma, a small town here in Arizona, and went off to school. And I did have a little girl when I was 21. And kind of coming out of a tough situation, one of the things I decided to do for myself after breastfeeding her and raising her, being single, was to get a breast augmentation. And when I chose to do that, good, you guys can see us. When I chose to do that, the physician I chose to go to was in La Jolla. So if you guys know the San Diego area, it's a very well-to-do area. I went to a premier surgeon and really was not told at any point that there was any dangers. The only thing that I can recollect being told was that the saline were safer than the silicone. And that's what he advised me of and recommended I get. So
Did
go ahead.
he inform you, were they supposed to be with you forever, the same set, or do you remember that conversation? Or did he say that you would need to get them replaced every once in a while, depending on your exam and your symptoms?
Yeah, so he didn't explicitly say that I could keep them forever, but he never even alluded to or suggested that they need to be changed. It was just kind of a go ahead.
Was he board certified in plastic surgery?
Yes, he is. Yeah.
Okay. All right. So again, the point being, you want to make sure that you go to someone who understands because every surgical procedure has its risks and benefits, and let alone the implants, they come in with a whole set of problems. And it's very important, as we know today, the warning that the FDA has put out that, implants are not safe and they come in with a set of problems. And the patient needs to truly give informed consent that they understand. So they need to be vigilant. They need to know what to look out for. What are the signs, symptoms? And so again, it's important to have done the homework because sometimes the surgeon may not disclose fully just because of the consultation. He may not want to deter the patient from getting the implants, amongst the many other reasons why and why not. So having said that, please let us know, Allysia, what happened next.
Yeah, so I went in and it was very casual. It was very like a boutique plastic surgery office, and I felt like it was as casual as somebody maybe going in to do, you know, their eyebrows or, doing maybe Botox or something where people treat it like it's just come in and casually do it. There was no sense of this is a major decision. There was no dialogue about, do you want to do this and what are the potential risks? There was just nothing on that. I did sign paperwork, and being 24, I'm sure that I could have been much more diligent in reading through that. And I've since requested that paperwork from my physician. So I was, like I said, 24, and I got Mentor saline under the muscle, and I had a fine recovery. And I would say that I did not experience symptoms for at least 2 years. While I started to feel like I was fatigued and like I was tired, I was also a young mother. So I had the implants done in 2004, and I was married in 2008. And I'd say in that time, I didn't have noticeable symptoms that I would have called debilitating. When I got married in 2008, by 2009, I was a newlywed. And when I would get up out of bed in the morning, sometimes I couldn't walk to the restroom. I had so much pain in my arms and legs that they would buckle. And I had no clue why. I had no idea why. It was some days debilitating, and some days I felt okay. But I really
Hmm.
started to experience inflammation throughout my whole body starting in 2009. And I would say for the next 6 years, I was just suffering and isolating myself and feeling sick. And I started to go to doctors who were not able to diagnose me with anything. I was told I should lose weight, but I had a personal training background. I knew how to work out. I was being careful. Nothing was working. And when I would lift weights, I would experience excruciating pain, and the recovery was really, really painful. And I was always exhausted. And so my poor husband, uh, sometimes he was a saint, sometimes he was just really frustrated, but he started to identify me as just being sick. Let mom stay on the couch, let mom rest, she's tired. It became like the mantra in our house constantly. My kids would bring me ice packs for my abdomen
Wow.
because,
So this is when you were almost like in the late 20s, early 30s.
yeah,
Yeah.
this
Yeah.
is like 20s to early 30s. I would say it was 2014 when my husband had a friend who had celiac, and he said, maybe it's food, maybe you have celiac. And so I went and got
Hmm.
tested. I did not have celiac, but I was allergic to wheat and gluten. So I got off that and I felt a little better. And then I started to food eliminate because I noticed that after I ate everything, I would get sick.
Hmm.
So with food elimination, I did that for a year. And after everything I ate, I got sick. So my abdomen would swell to the point where I looked about 5 months pregnant, and my hands would hurt to the point where I was a grad student and I couldn't type.
Wow.
And so we decided to go and get allergy tests. And I thought, you kind of rationalize your way through these health issues like they can be compartmentalized because nobody tells you there's any such thing as breast implant illness.
Hmm.
As I was going to doctors, they all knew, they all had it on the chart. It was my only surgery. I was very healthy before. I was a personal trainer. I was vegan, and very, very thorough with that lifestyle.
You did all the right things. Obviously, when you're young and healthy at that age, you can take a lot of resistance and a lot of shock, and obviously, when I use the word shock, meaning insults to the body. But
Mhm.
your body was taking these hits, and obviously, it was showing with all these signs, symptoms that you explained. So, what happened next following that?
So I went to an allergist, and it was actually there was a lot of painful experiences. There was a lot of hard experiences with doctors where I had a doctor want me to staple my stomach. I had a doctor tell me it was just weight. I had a doctor that found an issue with my thyroid. It was barely under the numbers. But there was a lot of there was almost like a post-traumatic stress syndrome from dealing with physicians and from going to restaurants because I would have to tell them all the things that I couldn't eat. So I wanted to
Wow.
get some evidence. I went to an allergen and I got tested for all the food allergies. And this physician kind of was really unkind and said, don't chase down allergies. Don't plan on being allergic to things. People often want to put a label, but they're not allergic. So they did the test, and sure enough, I came back allergic to poultry and beef and fish and shellfish and eggs and soy. And she came back kind of with her head down and a soft tone and said, I've never seen anyone like this. I've seen one person close, but not this bad. So
this is pretty much everything.
Yeah. And so since 2014, I've been strictly vegan, no gluten, no wheat. And somebody in the comments asked if they've resolved. And I'm hoping, I'm going to take it slow. I had my explant on October 23rd of this year. And we'll talk more when Dr. Khan leads into that portion of our talk about what I've experienced since. But I am hopeful because there's been so much healing already and immediately. So go ahead.
Now you go to the allergist, immunologist, you basically get this feedback. What happens next?
After that, I was hoping that was the answer, that somehow I was some kind of alien and I had all these food allergies, and if I just avoided them, that I'd be okay. But I started to develop more symptoms. I started to get really intense migraines, and my arms and legs would tingle and go numb. And one of the most recent symptoms right before explant was my left lower lip and my left eye started to twitch uncontrollably. And so I thought, maybe I have MS, or maybe, I have some nerve disorder. And there's so many times along this journey where I really thought I was dying, that I was in my 20s and early 30s. And there was some mysterious illness that doctors just didn't know about yet. I convinced myself that I was just in the wrong generation to live healthy, that with all the advancement, there was no way for me to really have a whole life. And I would isolate, and I did a lot of damage to just mental health and my family. My husband would want to go out and do stuff, and I would get angry with him if he'd try and talk to me after 10 p.m. And I admit that shamefully, but I was so sick and exhausted that I just couldn't even mentally conversate, and I was nauseous every day. I tell people I was nauseous every day for 10 years, and that I was exhausted every day for 10 years. And
right now, how did you hear about so I remember you were telling me following this you had as you were typing or you were on your desk that one day, what happened? Please remind or tell our viewers.
Yeah, so the next step, I for 2 years I saw a specialist in San Diego who was a medical age management. So he took every test that he could think of. We did intestinal permeability tests. We did epigenetics. He took like 13 vials of blood at a time, and he found that, and then we did scans of my abdomen that I requested because I was in so much pain. So he found an enlarged liver, low functioning kidney. I wasn't absorbing nutrients. And so I worked with him for so long, but he couldn't tell me why. So I then saw a naturopath who said the same thing, who said, you shouldn't be experiencing these symptoms, but I can't tell you why. And she gave me a really intense detox to do. So I went home really broken, really defeated, because I couldn't get a diagnosis. And I had a feeling that I shouldn't do the detox. I don't know why. I wanted to wait. And I came home, and my husband and I, we work in ministry. He's a pastor. And so I have a strong faith, and I just prayed and cried, and I was just desperate for answers. And he was looking through our kind of indoor garage, and he brought me a card from a friend who had passed away in 2009, just an encouragement card. And I decided to look him up on Instagram and see what people were saying about him. He was the owner of a big company, and a lot of people knew who he was. And the first post on Instagram was his girlfriend from at the time he had passed. And she was telling her story. And it was the most, I felt like it was just a divine intervention. She had just had her explant surgery about 2 weeks before. She was getting I'm so sorry, I gotta move this guy. I've got disrupting our talk here. I'm so sorry, guys. Okay, I apologize. So I read all about her symptoms and they lined up exactly. And immediately I knew, and I called my husband and I said, Kevin, this is what I have. I need to get these out. I have breast implant illness. And I just got diagnosed on Instagram, and
Wow.
and I'm booking. And I started to Google, and I found you doing YouTube videos and educating people on what breast implant illness is, and and then I looked up your practice, and I just decided that after spending 10 years just begging for doctors to help me, just crying and not getting help, that I needed to go to a doctor. And I get emotional because it's harder than people realize, to just seek help and not get it. And so I knew that I just needed to fly to your practice and have a doctor who believed me do this procedure, because I knew it was going to be hard to find after going to so many doctors who knew I had implants and knew all my symptoms, but it didn't even occur to them.
Right. So one thing is very important, Alicia, is what you did is what I call pattern recognition. This is the term where you are able to look at someone else's signs, symptoms, and say, you know what, that's me, that's me, that's me. All your lab tests, all these vials, all these doctors, all this workup, the imaging, everything was unremarkable. And all of this ultimately led to and pointed towards breast illness because you said these were the signs, symptoms that you were experiencing. Now tell me, did you, and please remind me if I'm not mistaken, you had a rupture of the implant on the right side, correct?
I did, yeah.
Yes. So
Years
tell
cut.
us more about that experience, if I do remember correctly, if you could fill it in 2017, if I'm not mistaken.
Yep. In late 2017, I was sitting on my couch writing a paper for school, and I went to take a shower, and I realized that my left implant was completely deflated, and it was so obvious. It's saline, and when you have a saline rupture, it just is completely visible. And so,
Right. So this is very important. If you have a saline implant and deflates, if it punctures, you're not going to have like a 50% puncture. You're going to have 100%, just like I used the example, a water balloon. You basically puncture it, the whole water is going to leak out and the body will absorb that saline because it's the same saline that you get into your IV drip. So it is going to be an all or none phenomenon. Another example I like to give is like a flat tire on the middle of the highway that you have. You have to pull over and the rim is touching the ground, so it's essentially completely deflated. As opposed to silicone implants, you could partially bleed, leak, or partial rupture, intra or extra capsular rupture, and you will not be able to tell. And the ultimate tests there is the MRI. So in this case, you had what was a saline implant that ruptured, and you automatically, as a result, within the same day, you become flat chested on the side where you have the rupture, and you can see a drastic difference between one side and the other, where the normal side is basically the same volume, and this flat chest, the deflated side, is where you have the rupture of the saline implant. Yes, please go ahead.
yep, exactly. So it was completely obvious, and I freaked out a little. Obviously, I had a girlfriend who went to the same doctor who had asked me for the plastic surgeon's name like a month before, because she was going to go get a new set. And I'd been thinking about, what do I want to do about this? I really don't love them and don't know, you know, I had kind of, it'd been on my mind. And then all of a sudden one was ruptured. So I called the plastic surgeon, and he quoted me 10,000 base price for a new set. And he was highly recommending silicone. He verbatim said they're much safer now, which, looking back now, I thank God that I didn't take that advice. Or he said it would be 8,000 to get them taken out, and nothing about a capsule, nothing about any kind of procedure, just saying that was the price. But it was $1,500 to deflate the other one. So I really could only afford to deflate the right one. And so I went back in for a procedure, and it was very casual. And he took a needle and he pulled some of the fluid out of my right implant and then allowed the rest to be absorbed into my body. And that was his explanation.
Wow. So this was the third option
Mm-hmm.
where essentially purposefully and deliberately puncturing so as to allow for symmetry to be achieved so that you would be flat chested essentially on both and that you would essentially go about living your life with two ruptured saline implants in your chest.
Yep. And he made no inference to them being unsafe staying in. I actually called a couple doctors here, some plastic surgeons here in Yuma, Arizona, and they refused to do it. They said there's too much of a risk for infection. We won't deflate. And so there's this prominent plastic surgeon in La Jolla willing to do it. And, I'm in a small town and I'm thinking he must know better. I was definitely wrong, but I assumed that, I should go to him and I should do this deflation. And he made no mention of um, taking them out. He just said, let's let you even out and then decide if we want to put a new pair in.
So how much time did he spend with you to deflate?
He was in the office in the room probably for like 8 minutes. So
Wow. And I
yeah,
have to say $1,500 to essentially rupture an implant. And I have to say that's, I hate to say this, but I'm speak my mind. That is sad and shameful and wrong and unacceptable and essentially not the standard of care. And I question him and I challenge him. This is not how you go about taking care of ruptured implants. So deliberately, purposefully going out and offering what I would call as poor choices, and sad to say that. And it hurts me to even discuss this, but we want other people to realize that this is essentially what happens, and this is wrong,
yeah,
plain wrong. And so, again, very, very disturbing to hear.
yeah.
Now, what happened? So this was back in 2017, and I remember your words, the consult that you had. So what happened from 2017 through when you came and saw me?
I mean, to be honest, I just didn't care much about the fact that I had the implants in there. I didn't want new ones. I didn't want to spend that kind of money on that. It just wasn't a priority to me anymore. And so I got back to life and I didn't really think about the fact that I should take them out. It was like I can decide later. And unfortunately
Sure.
later became 2 years later and I got increasingly sick. And this is the time frame in which I went to the naturopath and the specialists in medical age management. I should tell you that when I talked to the plastic surgeon in La Jolla, that he wanted to know if I wanted to get them right away. And I told him, I want to wait at least a year because I have all these autoimmune issues. I don't feel well. I can't seem to lose weight. I want to work really hard to lose weight. And then I will consider getting the implants replaced. And he was like, okay, well, make me proud. But nothing about, oh, wow, you're experiencing autoimmune. You should know about this breast implant illness phenomenon.
Right, right, right. I will say this, rupturing implants is not a reasonable, practical solution to managing a already ruptured saline implant. That's not a way to manage this complication, which spontaneously happens. And if you look at the timeline, the implants are not meant to be forever. And so that time had come, and what could be more benign than you sitting on a couch doing your homework and writing your project that this ruptured? You're not physically active riding a bike or skiing or things of that sort that would potentially put the mechanical burden on the chest and cause this rupture. So
Yeah,
this is what I would call, essentially a spontaneous rupture, which absolutely happens because remember, the saline implants or neither the silicone implants are meant to be there forever. So how did you when did you know you had breast implant illness?
well, the second I saw that text, that Instagram post, I knew without a shadow of a doubt. And it really felt like this, like I said, just this really critical time in my health because some women will talk about how they feel like once they know their symptoms increase. And I've
Right.
heard that a lot. I don't feel like it was psychosomatic. I feel like it was a really critical time for me to know. I mean, I had a kidney that wasn't functioning, a liver that hurt and was enlarged, and they couldn't explain. I've heard horror stories of women dying and not being able to get a proper diagnosis that this was what was going on. And I feel like it was
Right, right.
my
No,
hands.
absolutely, absolutely. So today I saw a patient post-op, 6 days out. She's a lady that had been to the Mayo Clinic. She had been worked up with all the battery of tests, just like you explained, Alicia.
Yeah,
She had seen and sought consultation by all these docs, and no one could figure out what the problem was. Today, she comes to me 6 days post her explant, and you should have seen her face, her body, her kids, the two daughters that came in, and you would be like, wow.
Yeah.
And it was amazing to see her how she bounced back, and this was a normal functioning lady with no problems, very happy, very healthy life, very nice family, and a very good family in a sense that they were a productive part, just like you were, and the many thousands and hundreds of thousands of ladies that are out there. That what you mentioned, the numbness, tingling, the back pain, and the 10 years of nausea.
Mhm.
Now please tell me, what was your experience like, as far as preparing for the trip, coming all the way from Arizona to Michigan, Novi, Michigan, to get the surgery done?
Yeah.
How big of a challenge was it? Like, did you not say, well, listen, just driving distance from where you are in Arizona, you could access all the plastic surgeons in San Diego, Los Angeles, San Francisco, let alone all the other major towns neighboring, Arizona?
Yeah, so there's something that really impacts you psychologically when you go to doctors and you seek help for so long and you kind of get talked down to like you're not intelligent or you can't possibly have any kind of intuition as to your health or what's going on. And so there'd been so much pain that just really was rooted in dealing with physicians and also a lot of feeling betrayed, like feeling like they should have put a little more time in looking at and maybe saved me a couple years of suffering. So I really had a fear of just randomly choosing a doctor. As soon as I knew I had breast implant illness, it was like this strange, like juxtaposition of emotions. It was like relief and some almost anger, some vindication, some clarity. So I was very excited to know, but I was also devastated because it's something that I could have had relief from the the day after surgery, the day of. I could have been somehow made aware um, of this illness and maybe been warned to make a different choice. And so there's this really deep frustration that kind of emerged in me that thank God I'm not an alien and there's actually a reason for this, but also shock and just there's no way this is the answer, but it absolutely is. And so I jumped online and found some groups and started reading and educating myself and understanding what women are going through. I had felt completely alone in the world, and now there was this like massive tribe of women that were going through this suffering. And it's part of why I want to speak because I don't want that to continue. I want women to know. So I saw your videos and it just educated me and it was scientific, it was thorough, um, and it was a doctor that was um, seeking to help women heal. And I told my husband that I am booking a flight and I am going to Michigan and I'm getting these out. And uh, he said, not reluctantly, but I think with some fear, a little bit worried that it wasn't the answer, worried for me because I finally had some hope. Uh, but I called the office and everyone was really kind. And at this point, I think Jennifer, your um,
Yes.
person at the front there, like she would tell you that I called and cried and said, "Is there any sooner dates? I need these out so bad." I'm trying to hold in the tears, but I think she could hear my voice. And I got in within 6 weeks, and I'm not the kind of person that is afraid to do things alone. And I just really this had beat up on me for 10 years, and I just wanted to go and you know take authority back over that and do it myself. I really actually wanted to do it myself, and so it wasn't hard in the sense that I knew that this was the best thing I could do, and it was the only thing that made any rational sense in all of the tests I'd taken and all the doctors that couldn't give me answers because a lot of women get diagnosis and they are able to kind of say, okay, it's fibromyalgia, it's my thyroid. But I had doctors say, I don't know what's going on with you. This is very bizarre. And so I knew that process of them being baffled, there's no question in my mind. So,
Wow. Yeah. And again, you've been to all these reputable doctors, in San Diego and in your hometown. And these are, the same set of tests that literally I can tell you the women who are listening and who are going to listen, they've been to the rheumatologist. Ultimately it gets labeled as fibromyalgia
mhm,
or depression, anxiety. let's get a urine tox screen, make sure you're not on drugs.
Yeah.
Or, this is like a rare illness, we'll figure it out, but we need to do more tests. And the next thing you know, you're getting CT, MS, you're basically getting fooled by, oh, you need back injections for your back pain, amongst the many other things. No one is even looking at and considering the implants. This is exactly what happened to the lady from the Mayo Clinic, or the lady that went to a other doc, or the other patient who was at a major hospital here in Detroit for 8 weeks in the ICU, and everyone said it could not be, it could be everything else but the implants. And whatever this is voodoo, or we need to do more investigative medicine. We need to think outside of the box, and they're doing all sorts of tests, and lo and behold, nothing is pointing towards, no one's even considering breast implant illness, even though today there is very vast evidence. Look, you could read that Instagram and come up with a what you call that pattern recognition diagnosis. Unfortunately, that's what I go by too, and I tell the patients, well, the implants are not absolutely safe. They have these set of problems, and if you can relate and say this is what I have, and I have a questionnaire where patients correlate the two and with pinpoint certainty. And I ask my patients when they come in, what's the likelihood, what's the percentage you have breast implant illness? You'll be surprised how many of the patients, just like you said, 100,000%, 100%, 110%, you should see the answers. And I said, you bet, and time will be the proof to this. And I just want to make sure that you have had the pre-op clearance, the full certification, i.e. that, you have cardiac issues are resolved, because people have chest pain, palpitations, or patients have rheumatological issues or bad diabetes. I just want to make sure that there are no surprises on the OR table, because there are patients who could have back pain in addition to, or thyroid issues from what they did before. And so that we're not missing anything surprising. Now, how was your overall surgical experience like?
So I was really scared, and I held it together, but I think a lot of us women are just like convinced that we're not going to wake up, and we're just so fearful of it because you don't plan on having surgery. It's not a fun thing. It's not something we like go into wanting to have done. A lot of us feel kind of duped. Like, I now have to get an explant, and this is scary because a lot of us have children and families, and there's a lot of fear. So, you know,
Sure, absolutely. Any surgery will come with its risks.
right. And so I did my best to hold it together. I was very hopeful. I tried to read a lot of what women were going through, and to research more and more, learning about what silicone's actually made of, and just really solidifying in my heart and mind that I needed this done, and there's no other way. I mean, if there's going to be life, it's going to be life without implants. And so I was determined to do it. Um, the the funny thing is, I was actually getting a lot of grace from my teachers at the time, and we were studying hospitality the week before my surgery and healing the week of my surgery. So
Hmm.
the hospitality that I received before my surgery was so important. I mean, just to have an office and a doctor be kind to you after you've been through so much, just really inflicted pain by physicians, and then just to experience such profound healing after. I mean, I went in, and I was nervous, but I was just ready. I knew this was the issue. I didn't know whether my body had been through too much to get it
Hmm.
better, but I knew that it was going to get worse if I didn't get them out. And so I went in. It felt like I closed my eyes and woke up. So the surgery was, as far as like the anesthesia, was exceptional. I just went under, and the anesthesiologist was very kind, and I woke up, and it was like this immediate sense of like as if it was like cleansed or clean. Like, I didn't feel groggy, and I didn't feel like this heaviness on my, and I don't mean like my chest, like the implants, but there was like this, just, I don't know, I don't want to be poetic, like doom, but just like this just unease. There's this dis-ease that comes with your body always fighting and always not feeling well. And so that was lifted from the second I woke up. And I was wide awake. And I know that even the nurse that stayed with me was like, I've never been with somebody where I didn't really have to do much. And that we ended up talking.
Hmm.
She actually had implants and had never heard about breast implant illness, and it was just amazing to be able to share with her. And that's what we
Sure,
did.
absolutely. Absolutely. Now,
Um,
what's interesting is the anesthesia that I use is, again, there are different levels and grades of anesthesia that you can do. So, the anesthesia is where the twilight, where you're breathing on your own and no risk for clot. The most intense one and the is the general, where you essentially have the machine breathing for you, and the risk of clots and the susceptibility to, for example, breathing lung issues, whatnot else. So in this case, the anesthesia, this is if women have had a colonoscopy, the twilight. Sometimes I may have the LMA, which is the laryngeal mask airway. This helps where the patient is breathing on their own. And I always say, why do extra or unnecessary anesthesia when you can certainly get by? And this is where, and a lot of patients ask, do you think that's adequate? And I say, look, I have not had a single patient complain, even on social media or, we can always go the next level up. Now, once I was operating, patient had a ruptured implant and an abscess. All of a sudden, I had to do a lot of dissection around the muscle. I all of a sudden requested the anesthesiologist, go ahead and intubate, and I need paralysis because I'm going to be doing a lot of extensive dissection. And for the patient's own good and comfort and support, and with the right DVT prophylaxis, where I had given the patient sub-Q heparin, 5,000 units of sub-Q heparin, because I do not want to clot. And this is per protocol. Every single patient, regardless of twilight or not, they get the SCD boots. Again, these are all the standard of cares that need to be undertaken so that we offer the safest anesthesia. So to answer the question again, the anesthesia was good and very effective, but essentially at the same time effective and minimal. It was not general anesthesia, and very rarely have I had to do that unless absolutely required and mandated. The other thing is that for the first post-op day, we need to make sure that the patients are with someone, because, one thing is for very dramatic. I remember I texted you once I got done with my third case for the day, and I said, how are you? And you said, for the first time in 10 years, on the day of the surgery, and I remember I have your text, you said, I'm not nauseous. And I said, we're on medicine, on surgery, can you say that? Where you have this feeling of nauseousness that you're going to vomit, and post-operatively, you should be experiencing that, especially after having come out, and you did not feel the nausea. And that was very, like, I remember, consistent with the breast implant illness. Now, remember, you did not have like 500 cc or 400 cc implants. Your implants were ruptured, so there was not much volume or a heavy effect. That burden of your chest was that inflammation slash that angriness that you had on top that was essentially taken away. And I could say with certainty, look, few hours after surgery, you're in your hotel room, and I swung by and I said I just wanted to say hello and see how you were doing. And the nurse that we had gotten, because we want to always make sure that you have someone with you at all times. God forbid you were to get up and feel dizzy and fall down. And this is the standard of care, because again, there is no cutting corners. This is where we're following the book blindly and meticulously. So we follow essentially how it would be done in any place else. So you have to have a loved one be you by your side. And so this is where you can see the dramatic effect pretty much right away, where patients are driving home to Columbus, for example, or Big Rapids in Michigan, or Grand Rapids, and they're like, wow, my eyesight was better. And I will tell you, it is very real. Now, what would you say? And this is what I asked Cheryl, if someone from the FDA was listening, or one of the other docs, or one of the other patients, how much better do you feel now compared to what you did before you had the surgery? As far as what improvements have you uh, realized, and have you felt, and your family and your friends have noticed in you having had the explant done?
so if I brought my kids out here and I asked them if there's a difference, they would say that you're a completely new person, like a new mom. Um,
Oh,
my husband and I can talk after 10 p.m. without me feeling like I'm going to collapse and lose it emotionally. So our relationship is better. I woke up from surgery and my hair didn't hurt anymore. My scalp always hurt. I had horrible migraines. Um, I shaved before the surgery, and I never shaved because I would have such irritation on my skin from shaving. But, ladies, I didn't want to go in there unshaved. And so I did. And I, for the first time in a decade or longer, because I believe this irritation started right away, could actually not get a rash on my leg. So I chose to do it beforehand just because I needed to and I didn't have any other option. And I assumed that the day or two after surgery, I'd have this massive skin irritation. Well, I never did, and I haven't since. I haven't had any irritation. I can do normal things. The night of the surgery, I laid in bed and I took this deep breath and it woke me up. It was so profoundly unusual that it woke me up out of sleep. I had not been breathing deep. And so, if I were to speak to the FDA, I would say they need to get outside of the box of thinking or the corporate grade or whatever it is that's keeping them from not listening to women and take heart. And there's so much that is out there that has a diagnosed label that is simply based on common symptoms. I mean, there's so many things that you might be diagnosed with that are just, maybe it has any intestinal inflammation has a label and you're able to call it something. There's nothing unusual about a series of symptoms having a name. And this is way too profound and way too broad. And you can't tell me that I'm 50, 60, 70, and these are normal health problems to have. And the fact that they just radically went away, I mean, immediately went away. My hair was really oily for the first month after explant because my body just wasn't producing oils, and all of a sudden it was. I haven't had any joint pain, zero joint pain since surgery.
Wow, that's big. I have a patient of mine, Alicia, and everyone else who's listening. She actually went to a pain specialist and she had 4 injections on her back, steroid, just to help control the inflammation and the pain. And look how dramatically you bounced back.
Yeah, there's no, and I know that without a PhD and without an influential ear, that absolutely is inclined to listen to me, it's difficult to convince people of breast implant illness. It's difficult for the medical industry to change, but there is absolutely zero doubt in my mind that this is what was destroying my health and wrecking my life physically, emotionally, psychologically, and that just doing something as simple, not simple in the sense that it's a surgery, but simple that it's a solution somebody could have given me, saved my life. And now I'm 38 and I actually feel like there's hope that I might be at my daughter's wedding, that I might be able to raise my boys where I really thought that they weren't going to have a mom,
Right. No, and this is, I want to tell everyone, I, as a physician, know, and I have known all along since 2003, that this is very much real. What you said, you're a real human. Is this a placebo effect, Alicia?
No, I
Is this something that the world says that I will tell you, over the Thanksgiving break, I talked to a friend of mine, he's a plastic surgeon, and he said, well, I have, and this is the feedback that I, as a physician, as an MD, and a functioning part of society, I was told by someone that I need to go and get myself checked if I believe in breast implant illness. And I said to my plastic surgery colleague, you think my patients are crazy and you're now thinking that I'm crazy, and I say to them and each one of them and each one of the physicians, absolutely not. I just listen to my patients. And if anything, I tell all my patients in the consultations, the 13, 15 patients that I saw today with BII, be it post-op, pre-op, or directly post-op, this is very much real. This is, look, I got one of the journalists from Denmark reached out to me and she said, look, you're trying to fight the world. And I said, you bet I am. But guess what? We're making a change. Alicia's making a change. Cheryl from last week is making a change. Look, just like within the last year, France banned the textured implant. That's huge. The US stepped up after France sought leadership. And the US, very politically correct, took the textured implants off. Now there is a label warning. Now you and I flipped over a magazine, and this is like one of these magazines that you find at the newsstands, and lo and behold, in it was the breast implant illness.
Yeah.
It is very much real. You are very much real, Allysia. Your symptoms, the way you described very innocently and very strongly, that you ask any of your kids how you are, and the way you described that you got your life back, they got their mom back. This is real. This is real people's problems who are nice, productive parts of society, and they are being essentially beat up by the system, i.e., and I use the system, and beat up by the breast implant illness, where what we need to do is we need to recognize this, it is real. And the other question that I saw yesterday, and for any of the ladies that question the fact, or like she was told she had she had a breast cancer diagnosis, and God bless her soul, and hopefully she's able to fight this like the millions of women who have breast, and she was told by her surgeons that the breast implants are safe, and this is far from true. 350,000 complaints to the FDA is a real number that is being collected, if not more. Number two, 100,000 women on the Nicole website. That's a real number, if not more. There are a lot more women like you who do not know that it exists, and they could put the two and two together that they have the breast implant illness. Look at all the videos that I have put out where you see the calcifications, the inflammation, the effect of the implants on the tissues, the native tissues, how these patients, tens of thousands and hundreds of thousands of them, over not the only in the last 5-10 years, but in the 80s and 70s, who had the explants done, and how they bounced back, and how the implants obscure a real good mammogram and an exam, for example, and they're not meant to be there forever, which we know for a fact, and how the dramatic recoveries of all these patients. So I say implants are definitely not safe. And I say to each and every single person who is considering getting implants, who needs to who's considering about saying that saline implants are safer, just listen to Alicia's story. It is very much clear. You don't want to end up and suffering through, and at the end of the day, what I would call, it is not worth it, and it is absolutely not safe. And to make a rational decision and informed consent, you need to be aware of what is breast implant. All what one needs to do is go online, type in breast implant illness, and listen to the tens of thousands of ladies who have come forth and come forward, just like you, Allysia, who are brave enough to make this world a better place, I myself included, and saying, you can do better. There's other choices, other alternatives, and you're better off without them than you are with them, because you're only going to live through what many, many, many women are going through. And as you will see in 2020, as we move forward, more of this is going to come out, and the social media, and more of the women will recognize this, and these ladies that have gone to the many different nice fine institutions, and all their work have been negative, and they've been told it's unremarkable, they will recognize, and they will seek guidance, and they will seek the docs who explant and explant right, so that I can talk to Allysia post-operatively and say, look, your nausea is resolved, and your signs, symptoms, and all what you said, the back pain, this numbness, tingling around the mouth, all this arthritic pains, this fatigue, cognitive mind dysfunction, it's not in your mind only, it is real. It's a real consequence of the implants. And that I can say with certainty, because the surgery was done right, you're going to bounce back and you're going to heal well. Two things I want to mention. Number one, the surgery has to be done right. And what that means is, today I learned from a patient, her friend had a surgery done from a 3.5 centimeter incision where the whole end block was done. Virtually impossible. I cannot emphasize this enough. You cannot do an end block, remove the implant plus the capsule through that small 3.5 centimeter incision. Many of the surgeons who do it right, they know that they are going to be committing to a 8, 9, 10 centimeter, if not 11 centimeter incision, because we want to get this without rupture. We know that it doesn't, so there are some explant surgeons across the country who are doing a lift and an end block in 2 hours. That's virtually impossible. What do you have to say about that, Alicia, from what you know and from your readings and learnings?
I think that we are at the like the infancy of understanding what the proper standard of care is, and that I was very pleased to have come out to you, and that some of the things that I've seen other women going through kind of is it's heartbreaking because I'm seeing I didn't have to have drains. My incision was below the breast, and so I don't have a scar running up from below. Um, and so there was, and also I'm hearing about women getting them out and doctors saying, I'm sorry, I couldn't get all the capsule out. And my understanding
Right.
is that's like your muscle memory. That is the tissue that remembers why it's fighting, and it's going to continue potentially not to let you heal without getting that all out. And so I think right now in the infancy of understanding breast implant illness, people, doctors are doing explants, but um, not really being uh, insistent upon getting all the capsule out and taking the time, and that I think there really needs to be broader education
Sure,
inside.
absolutely. So I have seen, and the other patients have brought attention, like a patient got surgery done in Minnesota. Patient had the surgery done, the explant surgeon took out the implant and block, very nicely done. But then all of a sudden, lo and behold, to my surprise, it essentially ends up opening the capsule right on the patient's chest, and you can see the spillage of that silicone right on the instruments, on the bovie cautery, on the towel, and then she says, well, we're going to change our gloves. And I'll tell you, inevitably 110%, if you see the video, that silicone has made it into the chest, and now it defies the whole purpose of the surgery. Number two, leaving 10-15% of the capsule behind under the chest wall because you don't want to jeopardize the chest, the patient's health. That is wrong way to think about it, because now what you have done is you've left behind 10-15% of the capsule in it, which is the silica, the toxins, and that continues to mount the immune response. So if you cannot do end block, a total capsulectomy 100% needs to be done and accomplished, and it can certainly be done, no matter how adherent the capsule is to the chest wall. You know, the other day, and I'll put some pictures out where I actually had to uh, essentially remove and use the bovie where I'm literally dissecting right off of the cartilage of the ribs and the fascia off of the intercostal muscles. And that is very defined, very meticulous surgery, and certainly the right way to take care of it such that you're not leaving the capsule behind. Look, in your case, the other doc who's supposedly board certified, who purposefully, deliberately, over an 8 minute ruptures the implant and leaves that silicone inside. Where, you know, when I went in, just to emphasize, there was some abnormal fluid that was noted within that I had to send to cytology for CD30 to rule out the BIA, breast implant associated anaplastic large cell lymphoma. And so the point is, it certainly is in its infancy. And, you know, as I go about and I explant, I pretty much in my practice explain as to why, how, as a board certified plastic surgeon, how I do it and why I do it in the way I do. And I do it. Why do I emphasize the entire capsule needs to be removed? Because I have pathology final reports that dictate and say that the capsule in it had the silica, and that silica, had it, the capsule being left behind, the silica would have remained behind, and that would continue to trigger and mount that immune response, because that is the toxin that drives and causes all the disturbances of the breast implant illness that we know. If I may mention and take this opportunity to emphasize to everyone who's listening, and if there is one point that I want to emphasize, what are the qualities, what are the things to look out for? Like one of the other docs who's supposed to be like a nationally renowned explant specialist doing an end block and a lift in 2 hours. 100%, I will tell you, if I were to do just a lift, that would probably take me 2.5, 3 hours in itself, let alone an end block done right. Or docs who are leaving drains in for 2 consecutive weeks, regardless of what and how the surgery is, in 100% of the patients. And then not only having the drains in for the 2 weeks, but having the significant others or the patients remove the drains, which I find is consistent with what I would call not the standard of care and clearly malpractice, where the patients should not be removing, or the patients significant other, husband, or or fiance be removing these drains. So the five things to look out for: number one are the length of the incision. If your incision is 3 centimeters, 3.5, like the patient was mentioning today, chances are you did not get the end block like 100%, because you cannot get the implant plus the capsule from a small hole. You literally will hurt and rupture and cause problems. Number two, the length of time in the operating room. For me, on average, I take 4 hours, and you will see most of my patients from the time we come in and out, we're looking at that period of time. So on average, I do three of these per day, and I start at, if I do start at 6, I end at approximately 6 p.m., or if I start later at 8, I finish around 8 p.m. the same day. And this is exactly how long and what it takes for me to do the dissection right, such that most, well over 95% of my patients do not need drains. So the length of time. Number three, you have to send cap the pictures of the implants along with their capsules, so that you're seeing them on the table, such that you're seeing not only those but also of the chest wall, where you can see the chest rib cage and the intercostal muscles, which are void of the capsule. That's another way of not only the pictures of the implants but the chest wall. So I'm doing those two as well, sending or taking pictures. Number four, you need to get the implants back. That's very important. Many of the docs are not giving the implants back and saying, well, the hospital doesn't allow. And I'll tell you, if they're inside the patient's chest, they certainly can be out in a bag in a biohazard container, and the patient's not going to be hurting, because guess what? These were inside the patient's body to begin with. So they're safe, and especially in a container that's supposed to be safe. And that's essentially what I would say. If you get an intact saline implant back, you know that the saline implant was not ruptured, in order to ease the surgery, and then essentially removing the implant only, and basically removing part of the capsule. Number five, I mentioned, the reputation of the surgeon is key. If the surgeon is like, just right here in town, one of the ladies that was in the ICU for 8 weeks, the surgeon that did the case, she has no reputation. She has never come forward, put out any video, mentioned she believes in breast implant illness. And if you don't believe in breast implant illness, I assure you, you're not going to even do the surgery, right? Because you're not going to be fixated in removing the capsule. Because this whole thing, this whole story is about removing the capsule, if you summarize it. And so if the doc has no reputation about removing the capsule, has no history with the patients, then you know only that the surgery is going to be done on experimental, or well, I'm going to try to, if I'm not able to get to it. And I'll tell you, inevitably, if you don't believe in a cause, you're not going to fight from your heart. And if you don't believe in the breast implant illness, you're not going to remove, or you're not going to be fixated or motivated about removing the entire capsule. And so you will come out. So if you see some of the explant surgeons that are very proactive, like Dr. Fang and Dr. Chan, you can see the sincerity in their eyes. They understand the illness, they understand the physiology and the mechanism, and what and how it takes, and how they advocate truly that the capsule needs to be removed, and it needs to be removed in its entirety, 100%, with faith, and explain to the patient how and in what capacity the surgery was done. And these are the proofs that one must seek out, not be nice and say, well, I do not want to be rude and question my plastic surgeon. Unfortunately, in today's world and age, like the patient who had the breast cancer and who sought consultation, did that plastic surgeon bring to the attention of the patient about the breast implant illness? Because I think this is an important topic that every plastic surgeon should discuss with their patients. They should discuss the manufacturer's reported risks. They should discuss and mention the warning that the FDA has now requested, so that we make these patients educated patients, and so they understand what they're signing up for wholeheartedly. So I know we talked about a lot, but I will tell you this, looking at, I remember you texted around Thanksgiving, where you were having I was so happy to hear that, where, listen, you're celebrating life, joy, and just like a dinner and time off with your family, and truly enjoying the moment. That is priceless. This is why and what medicine is all about, where you have it, you bring about a change, you identify the problem, and yes, things evolve. And I will tell you, we're reliving this the second time. We are reliving the whole experience of breast implant illness, where now there needs to be a mass movement where the patients need to come forth. And I request each and every single one of the docs, be it the neurologist at the Mayo Clinic who referred the patient to me, who said to the patient, well, once you get the explant, and deep down within, he said, well, nothing is going to happen once you get the explantation. And once the patient gets the surgery done right, she's going to seek out to that neurologist at the Mayo Clinic, and she's going to go physically visit him and prove to him in person, listen, this is how well I bounced back. And hopefully we can educate the docs not only there but elsewhere, that we can say that truly is the implants and it was nothing else. And like, these are the proofs we have. Look at my sign symptoms. Look at me when I showed up initially. And the only thing that has happened, just like you, Allysia, it's not a placebo effect. It's not that I got off the drugs, God forbid, that everyone accuses these nice patients of, or the fibromyalgia, or the prednisone, or the change in weather, or whatever it might be, that it is truly the breast implant illness.
Yeah. And
Yeah.
I want to share that I wasn't on any other medication, and also just to answer a couple quick questions that were in the feed. Is that okay?
Yes, please, please, by all means, go ahead.
Somebody asked how long the recovery was in Novi, and I spent a week there post-op, and then they had me book a flight that could be changed, so insured. So if I had to stay longer, I was able to. And I toured Michigan, and I loved Michigan. And I was breathing fresh, cool air and seeing fall for the first time. We don't have fall in Yuma. And then
Mhm.
another person asked, well, no, they commented that they couldn't afford it. And I just want to share that I did care credit, that I'm going to be paying this off for months. But you know what? I couldn't wait, and I found a way. And whatever that potentially is for you, I just so recommend that you would find a way. And I agree.
Sure. Now, if I may mention, the sixth thing that I want everyone to consider. Now, I will tell you, in the operating room, you have anesthesia fee, the facility fee, my fee, just to open up an operating room, and this is the certified facility. That in itself is almost an $800 process. Where you have quality equipment, quality. I have three sterilizing machines. And the point, we don't cut corners. We do according to what is the quad SF, the highest standard. Many patients get treated in a place where they have a modified OR, which is they make a room without the right ventilation system, the right anesthesia machine, and they do it technically under, like you would do in a quick infusion. Or sometimes, even, believe it or not, I've seen patients under $700. This young lady, and I'll bring her as a guest next time. $700 at a local spa. They were going to do it under local. Believe it or not, removal of bilateral silicone implants. Unbelievable, if you can believe. So one thing that I always want to mention, and this is the sixth thing. One of the other local plastic surgeons who's explanting is offering it for $3,500. And I'll tell you, physically, from a financial perspective, to do the surgery under $3,500, it is virtually impossible. This is just like saying that, if I may, I do not know how to make the analogy. Let's say if you have a car that's worth 50,000 and you go get it for 10,000, there's a problem with it, that you're going to be in getting the incomplete surgery. So this surgeon is offering the explantation in 3,500, where the rest of the world is offering, if you factor in the hours, if you factor in the anesthesia, the equipment, the gas slash the propofol, and all the other medications that are given, the recovery, and everything adds up from the time you're operating, lap sponges, to name it. It is a costly venture. Just to, if you can imagine, just going to the emergency room and you getting billed for so much, and you go to the real hospital and just getting a surgery done, you see the bill ramps up. And so for someone to offer surgery for 3,500, 4,500, that's a big red flag, that someone is going to cut corners. They're going to do the surgery in half an hour, and be done, because that's the only way you're going to be able to justify that cost. And so that's another big red flag. And if you do the math, and if you look at the time that you spent, almost 4 hours or so, to getting the surgery done, to making sure that with certainty I can look in you and say, are you feeling better? I don't walk in and tell my patients, "Are you feeling better?" I ask them, "Tell me, how are you feeling better?" Because I know, just like you said, Alicia, on the same day of the surgery at 9 p.m. when I got done and I came by to see you in the post-op, and you had said that you have no nauseousness, that tells me, and I know that the surgery was done right. And I tell my patients as you leave, 100% of the capsule is removed, the end block with surgery was done, and that with pure faith, certainty, and devotion and motivation that you got the surgery that you got, which is the removal of the capsule.
Yeah. And you know what? I'm just speaking as a woman who's been suffering for a decade. I would have mortgaged my home. So I understand that there's cost quantified into giving care, and then they increase with quality. But I can say personally that, yeah, I would have mortgaged my home to get them out if that was what the cost was. But I felt like it was very much in. I'm hearing women being charged like over 10,000. So it was.
Right. So I have seen across the country 12,000, 14,000. Just like you said, you heard to get them just removed was 8,000 that your doctor had quoted you in San Diego.
Mhm.
Now, guess what? I just heard last week a patient called my office and she had implants inserted. So 2 weeks ago, when she had called, so now 3 weeks ago, believe it or not, in Florida. And she wants to come and she wants to do her explantation. And so this is a patient who just pretty much right after her surgery started having these signs symptoms of breast implant illness, chest pain. I requested that she go right away to her plastic surgeon, and her plastic surgeons basically deferred this to his nurse. And she's basically lost in this zone where she's immediately fresh post-op, but she's certain she wants to get these implants, and she's done her reading and her homework, and we know that the implants form basically make the capsule form within the 4 to 6 up to an 8 week mark. That's been shown and anecdotally and basically discussed at the meetings and conferences. Some people form sooner, some people even later. So there is now this young lady who basically needs to get an explant, and so she is fixated about getting the surgery right. And certainly she said she's gone to so many different surgeons and not a single surgeon is committed to removing the capsule. Now the capsule might not have formed in her case, but the due diligence needs to be given. If there is a biofilm, if there is any potential infection, whatever it may be, why is she experiencing these signs symptoms so early on, literally within 2 weeks of her implant augmentation. But anyways, I just wanted to bring that out. One of the questions that I thought was, I got my implant 6 months ago, and is it too early? And I said, no, it could happen as early as 2 weeks. And sometimes even some of my patients had said that the same day that they had the implants inserted, that they never felt right from that day onward. And I will tell the ladies that you can certainly comment, and I know we will find a lot of women that will come forward and say that they never felt the same ever since they had the implants inserted.
Yeah. And I know this is probably a hard thing for someone to hear, and I don't mean to say it. And I I think that they are so fortunate to have symptoms so early because they don't want to lose 5, 6, 10 years of their life. And
Hmm.
it's not fortunate. They're not in a good place. I'm not saying that at all, but I'm so grateful that they have not been in the dark for so long, because there are, like you said earlier, so many women who are just in the dark. And
Right. No, absolutely. I had this one lady. One other patient asked me. She had her implants inserted in 1981. This is back when Reagan became the president. And
yeah,
this is the latest video that I put out on my YouTube channel, Khan Plastic Surgery Academy. And I took them out just like a month and a half ago or so, a month ago. And you will see the nature of the capsule, the implants themselves, how they were ruptured and how they were removed and blocked. And this poor lady, she was on prednisone for all this time, given her severe, significant rheumatoid arthritis. And she lived with this all these years and her lifetime essentially.
yeah,
And she got this explantation done at age 64. And as you can imagine, I see what you're saying, that this is a blessing in disguise where she's going to not be suffering like the 10 years that you did.
Yeah, and it breaks my heart to hear stories of women having them much longer. I know I'm fortunate to have even, I mean, stumbled across what breast implant illness is in a decade, because it's just not being talked about. It's not on doctors' charts. The FDA isn't that interested in it, and you know, just to put a note out there on what you said earlier is I feel that we should be confident in what we know and the fact that we know we have breast implant illness, that there's generational evidence of the medical field not quite getting it, and then realizing what's going on. And so it's prideful to think that there can't be some condition or some situation that patients are in that we don't fully understand. And I'm confident
Sure.
that in 10 years, there'll be a lot of doctors saying, now I'm on board. And someone in
Sure,
the,
hopefully sooner. And this is what we are doing and purposefully having you as a guest because we want the world, the people, the journalist out of Denmark or the journalist out of like Brazil or someone, whoever it may be, who's listening in to say, you know what, we can put a face to this breast implant illness patient.
yeah,
We can say, listen, you are real. Your symptoms are real, just like the many thousands and tens of thousands and now this is what's unfortunately happening. Like I've said, you have the plastic surgeons. Unfortunately, we're not talking much. Number two, the manufacturers, they're certainly not going to talk. Number three, the FDA, they're looking the other way and they're just like muted for whatever reason, just like the FAA with the Max plane or the terrible pandemic that we had with the narcotics and slash the codeine and the Norcos and the Percocets that were overly abused and the system failed miserably and continues to fail unfortunately. And the Juul cigarettes and things like that. And lastly, it's the patients. Last but not least, we need to come out, and this is what I propose. I invite Dr. Chan, Dr. Fang, Nicole's group, Darby's group, the many other thousands and thousands of patients across the country, not only in the US, but across the world, to write, start talking, expressing our symptoms, very nicely, very, very tactfully, just discussing. This is, again, another nice tool where I can ask and say, you know what? If you get a rupture of an implant in saline, it's not proper to rupture the other one. It's only right to remove both of them and to remove them right. And so that the surgery is done absolutely right and that the patients be given their due and fair chance so that they can bounce back to their normal lives, which they very much certainly deserve.
yeah, absolutely. And
Yeah.
for you women who haven't explanted in the comments, just hang in there. It was so difficult the weeks leading up and the month leading up to my explant. But you're in the right direction and you're in the know. And somebody asked if I had gone back to the doctors who couldn't diagnose me and talk to them. I've dialogued a little. It's a very personal process, and I wasn't sure if I would really speak out about it initially. And they're kind of backpedaling. Oh, yeah, we know about breast implant illness. And yeah, that's something that, once you've ruled out everything, you kind of potentially look into. But these doctors should have, from the onset, had it on the table. And that's what I want. I want that to be on that sheet or on that diagnostic, mind. The doctor's awareness. If he's working with women, I want every OBGYN, every general practitioner to.
Absolutely, absolutely. Every endocrinologist, rheumatologist, pain doctor, every psychiatrist, so that they know that when they see this pattern, they can say, you know what, you need to go see someone who can figure this out because I'm not able to help you. Look, what you said initially, I was surprised when they wanted to staple your stomach. Why would on earth that doc tell you that?
He wanted to be. It was awful. It was an awful experience. He was an OBGYN. I had 6 miscarriages when I had breast implant illness. I could not get pregnant, and that's another just devastating part of our experience as a family. Is I couldn't conceive. This doctor, I had really heavy bleeding, and I went in and I was just desperately crying, asking for help. And he wanted to be the premier. I forget the term for the doctors who do the medical weight loss. he wanted to be the premier doctor in that field in Yuma, and so he couldn't help himself from trying to pitch it. And I just broke down in tears saying, please help me. Like, I'm in pain and I'm bleeding. And he's like, well, that could be due to overweight, and
That is so sad.
I
That is
know.
so wrong.
And I said, but I'm in pain. And he said, oh, well, maybe you have an ulcer. So he gave me some over the counter ulcer medication. And then he tried to hug me. It was one of the experiences that just scarred me and made me think there's no help. There's no help from doctors. I'm not, or never was I so overweight that should be on the table.
Right, right. No, and I remember I picked up on that when you said initially. I was disturbed to hear it because you have to have a valid reason. Because they're just offering unnecessary surgeries for something that doesn't exist, or unnecessary pain shots, for example.
Yeah,
But anyways, and again, it is sad to hear that, the patients, we want you, each one of you, the symptoms, you seek this out, you get basically evaluated, and there is more and more recognition. Now, what do I tell my patients? 100% you're going to be cured and helped. And I said, no, time is going to be the witness to that. And everything else, when a young lady in her 30s or 20s, or even with the mid 40s walks in and she has no other thing that's pointing towards anything but the breast implant illness, and all the workup has been negative, I can tell. And I usually ask them at this time, what is the likelihood you have breast implant illness? And each one of them says definitively it couldn't be anything else. And lo and behold, each one of them bounces back like you did, Alicia.
yeah, absolutely. It's
So, yeah.
yeah,
And so we need to make more awareness. I proposed, and this is what I was telling earlier, Dr. Fang, Dr. Chang, all of these implant illness web support groups and the patients that we create a day or a march, uh, just so that we can do it every year, so that we can start talking about it very innocently, just so that we make it more of an awareness. There's so many patients that walk in and they said, well, I didn't hear about breast implant illness till 2 weeks ago, and they look in and they Google and they go into all these face groups just like you did. And you, like you mentioned, there is a tribe of women, this family that basically are suffering together, and they understand each other. At 2 in the morning they're reading their other stories, and they're like, wow, that is pretty dramatic. And I'm certainly a believer. What makes someone in their late 30s leave their family and fly over to another part of the US and get a surgery that is the surgery that's going to help cure them of this illness? And someone like you who's determined and motivated, which is, if you in retrospect look at, a bold move, but a confident move. And you knew down deep down within that heart that Instagram message was the one that essentially brought the difference in your life.
yeah, absolutely. Um, Women need to know, and there needs to be awareness, and it's not gonna. I don't believe that it's gonna come through the majority of doctors, and thank God that there are doctors in women's corner, because we can't accomplish anything without that. I mean, I flew out because there was help. If there hadn't been help, I may still learn what was going on, but there have to be physicians who are advocating, because the medical world will listen to physicians. I don't believe that they're going to listen to women even close to as readily as they'll listen to physicians. And so it's so important. And my story is important. I know that.
And you have made a change, Alicia. You have people will listen. People will bounce this around. People will share this. They will relate to you just like you did with theirs, with their story. And I will tell you, we are making effective change one night, one day at a time, taking time out of our busy schedules. And, we will do this again after the New Year's. With having said that, Alicia, God bless you. Thank you so much for everything that you have done, and that you have shared your personal experience. It is very touching when you say, and if the FDA and the other docs are listening, that when you hear a child say, your own kids, that mommy is back, that is huge. The way you said it, and that is real. And you will impact a lot of people, and that is priceless. And I request each and every one of the patients to write about it on social media, because that's how the change is going to come. Two things I will say real fast. The election's coming upon us, And I always say one vote is an important vote. Every vote is an important vote. Your vote, Allysia, is like equivalent to a million votes. You have impacted that much. You have come forth and you've talked about this, and you will certainly impact someone, I assure you and guarantee you, someone in the middle of nowhere of the world, and be it in South America, in the Middle East, and the subcontinent, who will read and listen to this and say, you know what, I will connect. And just like in the last year, we have made big strides with the textured implants and also breast implant illness. 2020, as we move forward, we'll do this every 2 weeks. So probably the first week of January, we'll get another guest on. And if you have any questions for the rest of the other listeners, please certainly do ask, and I'll be more than happy to answer each one of them as we move forward.
Thank you so much.
Allysia, do you have, yeah, you have anything else to finish?
I just want to say that I didn't expect for this to be an aspect of my life or a platform or something to share, but I'm on social media. Dr. Khan has let me help admin his page. So if you have questions or want to know anything, there's even symptoms that I didn't mention, the brain fog and confusion and all kinds of things that I've experienced along the way. So if you have questions and you want to message me, or if you need someone to talk to or encourage you, please do reach out. I'm more than available, and I know what you're going through, and it's horrific. And there is a light at the end of the tunnel. I didn't believe it myself, but thank God there is. And so just know that if you need just some encouragement, that we're here for you in Dr. Khan's group. And then,
All right.
okay.
Well, thank you very much, Allysia. Thank you very much, everyone, for tuning in. Please pass the message on. Happy holidays and a happy new year. Bye bye.